Hello everyone, my name is Pedro Briones. I'm the Assistant Director of Harm Reduction at Boom Health's esteemed Harm Reduction Center. Today, we'll be showing you how to reverse an overdose via the administration of Narcan. Who we have here is Bob, and obviously he's succumbing to an overdose. Now, the first step would be to identify the symptoms of an overdose. Now, the symptoms may include shallow breathing, confusion, lessened alertness, and loss of consciousness. And just to be more detailed, what you're looking for, due to the fact that it's a time-sensitive process, you're methodically looking for those symptoms, meaning if the face is clammy and has lost color, if there's blue lips and the blue fingertips, you're also looking for that. If there's slow and erratic breathing and no breathing at all, if there's some gurgling sounds that we would like to describe it as the death rattle, and also if the heartbeat is slow or has stopped. Now, you want to do this all in a very timely fashion. You want to make sure that they're not unconscious for too long, because then there's brain damage that can occur. Now, if also the person is non-responsive to their name, at that point, you want to apply what we call a sternum rub, what I like to call a sternum grind, because at that point, what you're doing with the sternum grind is you're really applying a lot of pressure and trying to get them to respond to the pain. Now, step 2, once you've confirmed and verified that this person is possibly going through an overdose, you want to call 911. If not, you want to delegate someone to call 911. Small tidbit though, drug use stigma is still prevalent. Hence, to expedite the EMT's arrival, do not disclose to the 911 operator that the individual is suffering from an overdose. Simply state that the person is unresponsive and unconscious. Step 3, you want to administer the first dose of intranasal Naloxone. Make sure you have your gloves on. All this is you should probably do initially. You want to make sure you have your gloves on. Make sure you have your gloves on. You're going to open up the intranasal spray. At this point, you're going to push the plunger on the intranasal spray into the nostril. Now, once you've done that, you want to place the person in a recovery position, meaning place the person on their side. The reason you're doing so is just in case the person regurgitates or vomits or has any type of waste coming out. You don't want them to choke on their waste, so you want to place them on their side. If there's no response after the first dosage, you wait 2 minutes and administer the second dosage of Narcan. Put it back. Bob, you okay? Bob's all right. Now, once the individual is breathing on their own and has regained some sort of consciousness, you can place them back in the recovery position until the paramedics arrive. Comfort them as they may be confused, upset, going through some withdrawals, feeling sick from a lack of opioids if they're dependent on it when revived, and do not allow them to consume any drugs after they revive. At that point, just console and comfort them and await arrival of the EMT, and let them know that it's good for them to get a test at the hospital and go to the emergency room and make sure that all their vitals are good. If you don't have time to stay with this person, call someone for them. Call the person, their emergency contact, who they feel more comfortable with. Let them know what has just transpired to them, and await their arrival as well. Thank you guys, and stay tuned for more informative and educational videos from Boom Health.